Dr. Anthea Rhodes, paediatrician, joining you live from the Royal Children's Hospital in Melbourne. For the next hour, we're going to have a conversation about the way we can support our infants, toddlers and preschoolers to manage many of the ongoing challenges of the COVID-19 pandemic. Before we get started, I'd like to begin by acknowledging the traditional owners of the land. For me, here today, that's the Wurundjeri people of the Kulin Nation, and acknowledging the traditional owners of the land from wherever you're meeting us today as well. There have been many challenges over the past 18 months or almost 2 years that have made it difficult for families to continue to cope. And our children have been affected perhaps more than many in the community. And today we'd like to focus particularly on our young children and the way that they have been affected. Some of the topics that we'll cover include how they can be kept safe in the early learning and childcare environment, things like vaccines and their risk of catching COVID, and what about the stigma and difficulties of dealing with a diagnosis. We'll also talk about the mental health and well-being of our young children and parents, and some of the worries people have about lost opportunities and effects on their development and their mental health. This is a live session, so you are able to put comments in the feed, and we'll do our best to get to those questions as we work through the hour today. And a big thank you to people who've already put questions up. We'll do our best to answer those as well. Of course, we realise not everyone can join us right here and now, so we're recording the session, and it will also be available later today on the Facebook page, as well as the Royal Children's Hospital website, and also on YouTube. So now I would like to introduce you to our fantastic panel of experts joining us at the Royal Children's Hospital or from their workplace from home, as many of us have been doing over the last 18 months. Experts from the Murdoch Children's Research Institute, University of Melbourne and the RCH. So first up, we have Dr. Nirashini Kennedy, who is a developmental and behavioural paediatrician specialising in the care of children who are vulnerable and with additional needs. We have Associate Professor Gihan Roberts, another developmental and behavioural paediatrician and Associate Director of the Centre for Community Child Health here at the Royal Children's Hospital. Dr. Georgina Cox is a clinical psychologist who works in the Neurodevelopment and Disability Department and also with our psychology service. And lastly, Associate Professor Margie Danchin, who will be known to many of you from Facebook Lives. She's one of our regulars. Margie is a paediatrician and a researcher with an expertise in vaccines. Today, all of these experts will talk to you about many of your common questions. To begin, we'd like to look at some of the physical effects that people are worried about when it comes to COVID-19. And so the first question for today, I'm going to put to Margie to address something that's come in from Suzanne. So Margie, Suzanne has asked, she would love to know what the risk of hospitalisation is for under fives. How sick do these young children get? And also, if a child has previously been hospitalised with bronchiolitis or RSV, are they at increased risk of getting sick with COVID? Margie.
Thanks, Anthea, and it's lovely to be with everyone this afternoon. It's great to be talking about this age group, given some of the other Facebook Lives. So in terms of COVID illness in children under the age of 5, in the most part, it's like any other respiratory virus. So kids can experience fever, cough, runny nose, and children who have experienced bronchiolitis before can also have bronchiolitis triggered by COVID. So in the most part, it's like any other respiratory illness. Fortunately, even with the Delta variant, it's not more severe in children under the age of 5. But of course, severe disease can occur in the sense that some children might need admission to hospital. And that's usually for things like a little bit of oxygen or some fluids. And very, very few children need admission to the intensive care unit. And the children that we have seen that have needed admission to the intensive care unit have in the most part been older, so unvaccinated teenagers particularly, who fortunately do have access to vaccines. The children in this age group that have needed admission, a lot have had some other underlying medical conditions that puts them at slightly higher risk. And so we do understand that parents might be more concerned. And conditions that I'm referring to there are things like So some neurodevelopmental disorders, cerebral palsy, some children with Down syndrome, perhaps underlying cardiac disease, those sorts of conditions. And of course, we want to do everything we can to protect those kids. But children, for example, who have experienced bronchiolitis or asthma before are not at higher risk, fortunately.
Thanks, Margie, because I know that's a really common question for parents out there. You mentioned asthma just now, which is related in some ways to bronchiolitis, but, another type of very common respiratory illness in children. So a lot of parents have had concerns that those kids with asthma or underlying respiratory conditions might be at increased risk. So that's really reassuring for parents to understand that that is not going to look any different to a regular respiratory infection from another cause.
That's right. And what I would say is for those kids who have had asthma or do have asthma, the most important thing is just to follow the normal asthma action plan. So make sure that they are having their puffers, but that fortunately they're not at higher risk from COVID infection.
Okay, so a question that's slightly different now also for you, Margie, and this one's about long COVID. So we have heard quite a bit about long COVID, particularly in adults, and I know that it's been in the media a lot, and for many parents it's a source of worry because it's the idea that something well into the future might affect the health and well-being of their child. Lisa asks, can you talk about the estimates of long COVID in kids? She's seen them ranging from 4 to 40% in the media. And Lydia had a related question. Are COVID positive preschoolers particularly at the same risk of long COVID to COVID positive adults? So Margie, can you talk about those couple of questions, please?
Yeah, so long COVID is a really important topic. And what we're really referring to here are chronic lingering symptoms maybe 1 month or 2 months after the acute COVID infection. And they're things like fatigue, loss of energy, headache. It can be some sort of more acute lingering symptoms. And of course, older kids are able to express these a little bit more easily than younger children. And this is a very difficult topic because unfortunately a lot of the studies that have looked at long COVID have not used like one definition of those symptoms, and often they haven't had a control group. And what we mean by that is kids who've been tested for COVID but are actually negative, so they've had another respiratory virus, for example, and followed how commonly those children might present and report with some of these symptoms. And that's important because we know that lots of viral infections can cause some lingering and ongoing symptoms. So there is a lot of research still going on in this space using this good definitions, the same definitions with control groups, and it's very important. So we want to reassure parents that we're taking this very seriously. But the estimates, fortunately, are that this is quite uncommon, and it's especially uncommon in younger children. So studies, particularly from the UK, have had estimates of maybe like 2% of children might have lingering symptoms, 2 or 3 months on. Some studies maybe up to 14%. So it's somewhere around there. But I think in the most part, particularly for young children, we can reassure parents that it is quite uncommon. But obviously, if parents are concerned that their children do have lingering and ongoing symptoms, that they just need to follow up and make sure that they're seeing their GP or paediatrician or healthcare provider.
Thanks, Margie. And of course, we know that lots of different conditions for children, other respiratory infections and viruses can also cause prolonged symptoms and conditions. So in the same way that if your child is unwell for any reason, that you should absolutely follow up, but really reassuring so far, at least in children, that we're not seeing large numbers of children experiencing difficulties with long COVID. So related to all of this is the idea that obviously we're reassured that COVID is a relatively mild illness in the vast majority of children, and in particular young children. And I know if you're watching, lots of parents worry that when it comes to little kids, they're likely to be more vulnerable. And particularly when you think about babies, a lot of parents worry that perhaps babies are going to be more severely affected when it comes to COVID. So, Margie, do we have any particular information about the very young kids, those who are under 12 months of age?
There have been some studies that have shown that children under the age of 1 might be at slightly higher risk of more significant symptoms or severe disease. But fortunately, that's not a pattern that we've seen here, particularly in Victoria and through the children's. It's always really important that we keep coming back to the data and that we keep reassuring parents that, we're constantly monitoring the age groups, which children are getting sick. We know that we've seen a real increase in infections in children, and we need to really acknowledge that. It's up to about a third of infections now in kids, so we know this is a really important issue. But the big thing is, are kids getting much sicker? And fortunately, it appears not, although we're constantly monitoring that. In the under ones, as I said, they might get a little bit more unwell, but it hasn't been a significant signal that we've seen. So again, just to reassure parents about that.
Fantastic. And so related to that then, it might be a good time to start thinking about the discussion around how we do keep kids safe. So recognising that COVID is, in the vast majority of cases, fortunately not making children very unwell, it's still important for us to prevent this illness happening in kids for lots of reasons. So, Margie, we've got some questions here, quite a few really, that have come through about the early learning environment or childcare setting, where parents are asking, what is going to be done to keep my child safe? And in particular, they feel a lot has been talked about when it comes to school. But what about childcare and what about early learning environments? What are the recommendations there?
Yeah, and this is a really, really important topic because we know, for example, from the data from New South Wales in June and July, it was a really comprehensive study looking at COVID cases in educational settings, that 2/3 of the cases and outbreaks there were in kindergarten and early childhood settings, and that there was some onward transmission. But I just want to start by reassuring parents that most of those cases were in staff, and most of the transmission was between staff to staff and staff to child, that there was much, much less transmission between children. But of course, we do know that there are lots of cases occurring in these settings, as you said, Anne. So the important thing is, what are we doing to keep kids safe? Well, the most important thing is that all staff are mandated to be vaccinated in early childhood settings. And given what I've just said about transmission, you can see why that is so important. And of course, the second is that all parents and all eligible household members should be vaccinated, because the most important thing we can do is cocoon children and really give them that scaffolding and protection. Then in terms of the centres themselves, a bit like the school setting and the lovely 3 V's strategy that we have in schools, which is vaccination, ventilation and vital COVID safe steps, it's the same approach to the early childhood setting. So vaccination of staff, doing everything we can to improve ventilation in this setting. Now, fortunately, in most early childhood settings, classrooms are a lot more open, kids tend to spend a lot more time outside, so the ventilation is less of a challenge, but it's still a challenge, and there's lots of differences in these settings. So I'll get to that a bit more in a moment. And then in terms of the other measures, of course, hygiene practices and getting kids outside, learning outside is really important. And it's important to tell everyone that the Victorian government has actually provided some small grant funding and is working very closely with the early childhood sector, so that kindergartens in particular can apply for these small grants to improve ventilation. Particularly, that might be by building shade sail cloths, outdoor spaces, buying air purification filters, or maybe even, building more windows, or everything we can basically to improve ventilation in early childhood settings.
Thanks, Margie. And I think that probably answers one of the questions that we had from C, which was really about ventilation and particularly HEPA filters in early learning environments. So some really great information there, and perhaps for parents watching, it might be worth having a conversation with your own childcare centre or early learning setting about what they can be doing to actually improve ventilation as one of those 3 critical V's to help keep kids safe in that early learning environment. And of course, being outside is not just great for reducing the chances of catching COVID, but it's great for kids' health and wellbeing anyway, especially after many months in lockdown. So that brings us on to a related question, one of the biggest V's, if you like, and that's vaccination. So, Margie, we've got lots of questions about vaccination from viewers today, and remembering that really we're talking today about those younger children, so children who are under 5 years of age. So putting aside lots of other questions about vaccination for primary school kids, you know, there's been a lot of discussion in the media in recent weeks about when that might be coming, and we've got our teenagers who are eligible already and have had great uptake around vaccination, and of course adults, as you've talked about. But perhaps if we just focus on one element of this for today, and one of the questions, for example, that has come through from Christy is, when will vaccines be available for under fives? We're going to get back to extracurricular activities. Our kids are back in early learning settings. It's such a huge roller coaster knowing that they're not protected.
Well, the first thing is to reassure parents that there are trials that are currently underway in children aged 6 months to 5 years. So these data are coming. They're particularly looking at the Pfizer and Moderna vaccines, but other vaccines like the Novavax vaccine are also being trialled in children. So we don't have these data yet from the clinical trials, but we will have it in the next few months. So it's really just to ensure that parents know that these vaccines are in the pipeline, and that, of course, we understand that, you know, we want to try and use every measure to keep kids safe, especially young children. And so it'll be very important to look at these data and the safety and, you know, when we can use it for these children.
Thanks, Margie. And for those of you watching with questions about vaccines, particularly in this young age group, when that becomes a question of eligibility and we have recommendations and guidelines from ATAGI and the TGA here in Australia, then we will run another session that can really focus on those detailed questions that parents might have about vaccination. So moving on now to a really related topic, and that's some of the anxieties that parents might be feeling out there, and children as well, about actually getting back into that early learning environment. And so for this topic, I'm going to welcome Georgie to the conversation and put a question across to Georgie about how we can really help support our young children getting back into that early learning environment, and some practical tips for parents who might be experiencing a lot of hesitancy from their children about getting back out there. Georgie.
Thanks so much for having me today, and it's great to be here with all of the rest of our panel members. Look, I think it's really important to try and see this from the child's perspective. You know, this going back into the early childhood setting is something that, you know, is quite new. It's different to what they've been used to doing at home. So there's lots of different kind of really proactive strategies to help children with this transition. And I'll often say to parents, you know, preparation is really, really powerful. So, for example, you might be driving your child past the childcare centre, you know, doing that a few days before you get them back into the setting. You might be doing some of these lovely social stories with them. So, you know, showing them some pictures, talking them through what that's going to look like when you take them. So, you know, we're going to go tomorrow, we're going to see our educators, we're going to see our peers. There's going to be lots of things for you to play with, maybe talk about some of the, you know, their favourite activities that they can do there, and really build up that sense of excitement for them. For some kids, having that visual schedule, so, you know, that really clear plan with some pictures is really, really helpful for them. Now, on the day that you're there, you know, if you do experience some resistance or anxiety from your child, you can just kind of take stock of your own reaction in that moment, you know, that kind of wiser but very kind kind of body language that you can use with them. And I've often found it really helpful to talk with parents about, you know, reaching out to their early childhood centre, if there's something that they can do, if there's an activity that they can kind of, get them in there with. So, for example, I remember a young girl who was really, really anxious and actually getting a plant inside the room, and then every morning she would go in and she would water the plant, and that was actually a really lovely way for her to also see something growing and get her really excited about going back into that setting.
Thanks, Georgie. So some thinking differently, perhaps getting organised, getting in touch with the early learning setting or the childcare centre ahead of time to really work through a strategy and approach to getting back through the door, and recognising that it's not necessarily going to be easy and that some of those anxieties are understandable for children. I think for many of us it's really important to remember that 18 months or 2 years, when you're older, if we're going to call ourselves older, might not seem like very long. A couple of years ago, the things you were doing and the way you behaved wasn't that different perhaps to how you might feel today, even though we've all been through an enormous amount. Remembering that for those children who are under 5 that we're talking about today, your toddlers or your preschoolers, that's a huge amount of time. It may in fact be more time in their lifetime that they've spent in the pandemic experience than out of it. And so it's really hard for them to remember life before, or the idea of, we're just getting back to normal, because for very young children, they can't actually remember in the same way as we can what it was like before. And so it's important for us to try and stay very much focused in the moment and looking forward and helping them to get into things that might feel like really new and different experiences. So thinking about that and related questions, there are a number of parents who've actually said, I'm so worried about the risk of COVID. My child's really anxious about going back. I'm actually not sure if it's really worth it when it comes to going back to childcare or early learning or kindergarten. Perhaps you're not working and you're in a position to have your child at home, or you're deciding to make decisions about having them cared for in other ways. So I'd like to welcome Gihan to the conversation now to talk a little bit about that. And Gihan, I've got a really nice question here from a parent, Alea, that gives this example to us that really helps us to tap into this idea. She says, I feel like there's just too much risk out there to send my child back to childcare. He has autism spectrum disorder, things are difficult for him, and I don't really know if it's safe. So I'm wondering, is it really worth it? So Gihan, what advice have you got for Alea?
Yeah, thank you, Anthea. And I think it was great to, coming into that question, put into the mix all of the things Margie said about how we can reduce risk in those early childhood settings, and also the important information Georgie gave us about how to prepare children for those transitions. We do know that the home environment, a loving, nurturing home environment, is so important for the child's development, but we can also think about the importance of all those other environments where kids have those other extra experiences like unstructured play in playgrounds, those community experiences like playgroup and story time at libraries, and of course structured early childhood learning experiences like preschool and kindergarten. So we do know that taking part in those opportunities lay down really important foundation skills for when we're thinking ahead, for example, to a school transition. And I think one of the things we've all gotten quite good at during COVID is to constantly be balancing risks. So of course, parents are going to be balancing and doing this risk equation in their heads. But I think what I'd like to reassure everyone about is that the benefits of really re-engaging in all of those opportunities for children out in the community are likely to lay down really positive structures and brain development for their future.
Thanks, Gihan. And you're absolutely right. This idea of risk and reevaluating things is something that we've all had to become used to, and it's really tiring. I'm sure if you're watching, you might think about that it's stressful and you're exhausted and you sometimes feel like you just worked out a plan and then you have to rethink because the situation's changed again. And I think it's important for parents to know that you're not alone feeling like that, and that's been a really challenging part of the pandemic, and it's not over yet. It's continuing. And perhaps for parents, and especially parents of young children, it's actually getting trickier because they're a population that haven't been vaccinated yet, and decisions are having to be made about risk that are different to perhaps for adults who might be feeling now like, they're fully vaccinated, they can feel comfortable about getting back into their environment. So it's challenging, and as Gihan has said, it's about weighing up those risks and perhaps talking with people and getting advice and information if you need it to help you make the decision. So a little bit related to this, I'm going to come to Nero now and welcome you to the conversation, Nero. One of the things that has come out of the questions today as well is the idea of feeling a bit overwhelmed about re-entry. So I know myself as an adult, and I've got 4 children, we've found this week absolutely exhausting. I think because we're back into the swing of things and, we felt like we were exhausted and sick of each other at home, and now we're exhausted because we're back having to run everyone around and be in different places and catching up with people. So can you talk to us about what that experience is like for kids, and especially young children, those under 5 and perhaps even the infants and toddlers? What might be the signs that they're finding things a bit overwhelming, and how would you recommend parents manage that?
Thank you, Anthea. And like other people have said, it's been a lot, hasn't it? We've had, 18 months of being in and out of lockdown with rules changing. There's been so much uncertainty, and uncertainty takes so much energy. It's so stressful. And all of our reserves are a little bit down. And I think there is going to be a period of adjustment for all of us, for us as adults, but also for the little people in our lives. And I think it's really important to just reassure families that this is normal. The way you're feeling is entirely understandable. And usually with time, we will have a chance to adjust. It's a little bit like, when you're faced with, we've been talking about risk, and it's we have these stress hormones, the adrenaline system. And I feel like we've been all running on adrenaline for a really long time. And some of that is adaptive. We do what we have to do to constantly reevaluate the risk of, the fear of, are we going to catch COVID as parents? Are our children at risk? How do we negotiate these rules? How do we negotiate balancing, working from home and homeschooling our children? There are so many things. Even walking into a supermarket, there are 10 things you need to sort of remember to do before you do that. And so, our bodies don't immediately switch back after, that period has passed. And that takes a bit of time. And it's actually physiological, when our bodies are, primed, have been in an environment where we have been thinking about things that have been really scary, it takes a while to come out of that. So I think the first thing to sort of say is that just allow people to kind of accept a little bit that this is going to take a bit of time, and reassure people that if they're feeling like this and their children are feeling like this, that this is something that will get better as time goes on. In terms of what can parents do, I think there is no rush to rush back to all your activities, and I know that most of us, as soon as lockdown ended, there was a long list of things that we wanted to do. We wanted to get our hair cut. We wanted to go to the supermarket, to the department stores. Most of our kids have grown out of shoes. My daughter doesn't fit into her school shoes anymore. We want to see our friends. We want to go to our favourite cafes. But all of this can be quite exhausting for us and for our children. So I think pacing ourselves, and so maybe focusing on a couple of things to do each weekend rather than back-to-back social engagements or extracurricular activities can be really important. Making sure you're controlling what you can control. So making sure that in the midst of all of this, that you're making sure that the little people in your lives are getting plenty of sleep, are getting nutritious meals, doing things that fill their tank. So time in nature, unstructured play, all incredibly important at a time like this. And I think the other thing that parents can do is to, and we've touched on this, Georgina mentioned this, is to really try to make routines really simple, repetitive and predictable. We all cope so much better with stressful things when we have some routine to fall back on, and particularly when our stamina has been really, affected from a long lockdown. I think it's really important to just, perhaps use a visual timetable. So maybe snap some photos and use an app that sort of makes a collage of what the bedtime routine might be, or getting to school routine. This is, we put on pack our bag, put in a lunchbox, those sorts of things, can provide a measure of safety in that routine for very young children.
Thanks, Nero. I think that concept that if you can reduce unknowns, you can reduce anxiety is really powerful and important for children, particularly really young children. And I think the other thing that really resonates with me listening to you then, and I'm sure for many of you watching, is I think as parents of young children, you've had really, in some ways, the toughest run through the pandemic, and particularly in Victoria where childcare and early learning centres were closed for quite a long period of time, and parents were expected to be working remotely from home and caring for very young children, which is almost an impossible task really to do in combination without feeling like you're incredibly stretched and overwhelmed. And so we're kind of coming out of all of that, and the word that you used, Nero, I think was depleted, and we're hearing that word a lot, and you may be feeling that way, and your children might be feeling that way as well. So going gently and recognising that it will take some time to replete or build back up some of that stamina and energy to get back to a full picture of what might be our new COVID normal life. So something that I'd like to move to now it's related to some of these things we've talked about today, and that's actually a diagnosis of COVID. So we know that because in settings like early learning environments at the moment, young children are not vaccinated, and even though we're doing so many things to protect them, and we've heard in great detail about those today from Margie particularly, there is still a risk that children will be exposed to COVID, and in some cases they may actually contract COVID and test positive for the virus. And you might be watching and actually have had this experience in your own home recently, or perhaps you know someone in your family or through the network of school or early learning and childcare where this has happened. One of the things that we've found has been experienced by some families is that the idea of something called stigma, where they feel that it's really difficult to actually manage the feelings of guilt or perhaps worry and fear that come with that diagnosis, and particularly with the way that people around them react to the diagnosis. So we're going to talk a little bit now about how to manage that, and particularly I'm going to come to Georgie for some advice for families and also for communities around families and children about how we can actually reduce the idea of COVID stigma. And I've got a great question here from a parent, Sophia, that I think captures this really nicely. So Sophia said, "My whole family had COVID, my parents, my husband's parents, even my young baby, and it was awful how people talked about us. My son is too scared to go back to school because he thinks it's all his fault that school got closed down. How can I make him understand that this is not his fault?" Georgie.
Yeah. Firstly, I'd like to say, Sophia, that I'm so sorry that you've had that response from people. And, now is the time for us really as a community to think about how do we want to have those conversations about COVID. Okay, so we might be thinking about some underlying values. So having those conversations in a supportive way, having them in a respectful way, and having them in a positive way as well. So I kind of just want to almost go back a step and think about, there are lots of different ways that you might feel if you receive a diagnosis of COVID, or even if you get a call from your early childhood setting saying that you're a close contact of someone. Okay, so that can be really scary for some people. Some of the things that might be driving that fear is thinking about, well, what's going to happen? What's going to happen to my body? How is my body going to cope with this, even if I have been vaccinated? You might feel guilty. Yeah, some people report feeling guilty because they feel like they may have unwittingly passed on the virus to other people. Okay. Other people might actually feel quite angry as well, quite thwarted. I've just got back into my regular routine and here I am again and I'm going to have to go back into isolation. Yeah. So first of all, the message that I really want to give is that, whatever feelings you have, that's okay. That's really normal. We can acknowledge those feelings, but also just put them in perspective. So, for example, feeling guilty, just know that this isn't your fault. This is not your fault. Okay, and you've actually followed all of the guidelines that you can to keep yourself and your family and your community safe. And this is just part of the world that we live in. Okay, so that's kind of the first thing that I would say to people. And I guess this is where we kind of can start thinking about how we respond to stigma. So take a moment, if you haven't been in that situation, to think, how might I respond to that? Do I think that I might feel angry? If I receive a diagnosis, how might I talk about that with other people? Who would I like to tell? You might even role play that a little bit, practice it. You know what, actually, I've contracted COVID, so I'm going to have to stay in isolation for the next couple of weeks. That's really important for, everyone to stay safe so that we can get back to doing the things that are really important to us. So it's quite kind of matter of fact in many ways, isn't it? And so kind of coming back to Sophia's question, we can role model to our children and to those around us what these positive and respectful, conversations look like. So in terms of Sophia's son going back into school, if that's something that he's worried about, maybe you can talk about that with him and say, actually, if somebody says something to you, how might you respond? What might you say? And talking to the teachers as well, because we are talking about a school setting here, reaching out to the school and saying, how might the school support children to talk with other children about this, again, in a really respectful, kind and supportive way. And also, I think for your son, if he is in the situation where another child says something to him that does make him feel uncomfortable, let's get an action plan in place for that. Let's equip him with some skills to be able to proactively reach out to people that he trusts in the school environment, and also to be able to come home and talk with you about that. So sometimes I'll sort of, use a bit of a hand, hand of support. So I'll say, okay, in school, can we think of a couple of people that you trust? It might be a teacher, it might be a friend, it might be the principal. If somebody says something to you and it does make you feel really upset, are there a couple of things that you can do to just help yourself in that moment? You might go and play with your friend, you might go and read a book, just so that he can actually pull out that hand of support in that moment and he's got a lovely plan to go with.
Fantastic. Thanks, Georgie. I think we could all do with a hand of support in our lives at the moment, or always to call on. But those strategies that can be there, particularly when you're feeling overwhelmed, and we know for young children, and we're going to talk a bit more in a moment about that sense of regulating emotions. But we know for all of us, there's been big feelings over the last 18 months in lots of different settings, but particularly for very young children where those emotions can become overwhelming, having a bit of a go-to plan is going to be really important. And I think some really powerful words there from Georgie for all of us about how we talk about COVID as a community. And we are talking about COVID every day. You'll be talking about it with family, with friends, with your children, in front of your children. So think about the way we choose to frame that, and remember to steer clear of the concepts of blame and guilt, because those things really then percolate through and become the basis of stigma, which can create a lot of really negative feelings and experiences for adults and children in our community. COVID is going to be here with us for quite a long time, so we need to think about how we manage that and talk about it together. So I'd like to move on to the idea of regulation and emotions, and particularly lots of parents had questions about missed opportunities for their kids. So we've spent a large part of the last almost 2 years, particularly in Victoria, but in other parts of the world and other states in Australia as well, in some sort of lockdown or situations of relative social isolation. And lots of parents had questions for us about how that may have affected their young children for the long term. Has it affected their development? Has it affected their mental health? What should they be looking out for? What should they be doing to make up for lost opportunity? So firstly, I'm going to actually come to Nero to talk a little bit about the young children. So when I say that, I mean infants and babies, and parents who are worried about the fact that they've got a pandemic baby. I actually have a pandemic baby also myself, but where you might not have had the supports you would normally expect to have around you. We've got questions and comments from parents about where they feel their child hasn't met anyone, they haven't been out there and engaged with the community in the way that they normally would expect would happen in the celebration that is that first year or two of life. So Nero, what sort of advice do you have for parents of very young children and babies about the impacts of the pandemic and what they can be doing going forward?
Thank you, Anthea. And what a difficult time it must have been to be a particularly perhaps a first-time parent, but even for yourself, Anthea, as a fourth-time parent, because all of the rituals and all the special moments that we share with family and friends, we haven't been able to do that, and there's no doubt that's added a lot of stress and sadness to families at a time that's usually such a joyful one. I think a really important thing to reassure parents about is that what very young children really need is very simple, and they obviously need a safe environment where all their basic needs are being met. So, shelter, food, warmth, all of those things, and they need to have a really warm and secure relationship with their key primary caregiver, their mother or father, or perhaps their carer. And so in many ways that is such a central part of what promotes healthy development in children. And usually, if parents are remaining well and if they're able to sort of tune in to their children's needs, and we talk a lot about a very simple concept of serve and return, which is really based on just that back and forth interaction that a parent and child has. In the midst of the pandemic, my children are quite beyond the baby stage, but I still remember it so fondly. And we were looking back over some old videos that we had. And it's just those simple moments where, it might be that you're practicing turning the pages of a book or playing a back and forth game. And it is in those moments really that are the most important things in terms of healthy development for children. So most parents have still been able to do that. And I think the sorts of parents who have these concerns have clearly had their children's development and well-being front of mind. So I think we can be reassuring that parents have been able to do these sort of small moments at home, and children are resilient. As life goes back to normal, you will find that most children, of course, might take a bit of time to settle into new environments and new things, but if they are approached in a staged way, in a gentle way, with the parents scaffolding, that most children will bounce back really well.
Thanks, Nero. And that taps into this question from Riju, which I'll just read out because you might want to add some thoughts around this as well. And she said, "My baby is 1 and she has hardly seen any people. It makes me so sad and worried for her brain development and that she might become a shy person. She doesn't even recognise my parents because they're overseas and they haven't been able to see her." So what sort of things would you say to Riju? What sort of advice would you have to her about her baby?
Yeah, and it's a really understandable concern, isn't it? I can hear the sadness in her question about, really important people in a child's life like their grandparents. I think, as life starts to go back in with gentle introduction of people into Riju's babies circle, I think you will find that with some time and some scaffolding by the parents, that children will get used to this. It might take some time, but I think I'm fairly confident that babies will, with some exposure, will catch up.
Thanks very much, Nero. And I think that's a good reminder as well, and we'll talk a bit more about it in a minute, but about parents' own mental health. And having experiences like this can be extremely challenging and make you feel very sad, and like perhaps things are overwhelming. And if you think that you might need some additional help or support through working through some of those experiences and the difficulties that have come, that are big for anyone with a new baby, but have been even more challenging over the past 12 months, then reaching out for professional help and support from your GP or other people in your network is really important too. And we'll provide some links to some resources towards the end. So just moving on to talk a bit more now about toddlers. So we've talked about babies, and I'm going to put this question to Gihan, who's nodding with a smile, because toddlers are always entertaining and they can be challenging, and luckily they're incredibly cute, because I think that's what, keeps us, it draws us in all the time, even though they push our buttons as parents so much. But one of the things that's come through from lots of people is actually the idea of toddlers and tantrums. And Ellie, for example, has a question here. Re-entry, as we're talking about today, has led to so many more toddler tantrums. How can we support our little ones to get through this? Gihan, what advice do you have?
Thanks, Anthea. And I think, just to echo what Nero was saying, this is common. So many families are going through it, and so many toddlers are experiencing these really big feelings when these new experiences come their way. But I think what we need to kind of step back and keep reminding ourselves about are the brains of toddlers and preschoolers. They're pretty amazing places. They're curious and engaging. And yes, they push boundaries and they push buttons because they're little scientists and they're explorers, and they want to see what happens when they have this amazing ability to affect the emotions of the people around them. And it's pretty incredible what they are capable of. So I think the tantrums that are happening as part of re-entry are a little bit different to the kind of traditional toddler behaviour management, where a toddler is demanding a second cookie or something like that, and you want to stand your ground. Because I think the tantrums that might be emerging, for example, due to re-entry, may be actually a signal or a type of communication to say, Mum or Dad, I'm not sure about this big world out there. I don't have a lot of ways of explaining it to you. So one thing I can do is just kind of drop my bundle and give you a really clear signal that I need you to be there for me, and really role model how to manage this confusing world. So I think that's one of the key things for parents and carers, is to remember that they're constantly role modeling appropriate behaviour, and then just to sort of be that stable, kind place where the toddler can come back to, and then really acknowledge when the toddler starts calming down and being able to communicate and be with you again. So I think the summary there is to take the behaviour seriously as the toddler may be trying to communicate something with you, and try and understand what are the kind of stress points in that small child's life that's leading to those really big emotions.
Thanks, Gihan. And I think you've tapped on something that I know I talk about a lot as well as a behavioural paediatrician, that idea that behaviour is communication. And so I think particularly at the moment with our very young children, these under fives that we're talking about today, where sometimes they can't tap into lots of language or the ways that we might traditionally think about communicating, often the way they're going to communicate is with their behaviour. And so for us as parents and carers or adults around them, recognising that that's what they're doing, and thinking, as you say, about what might be behind this and how can I support them. And there's plenty that might be behind it at the moment with all the challenges that are happening. So one more question around that developmental impact, and then we're going to talk a bit about parent mental health before we finish up. But this question I think is really important that's come through from Janie. And she said, I'm worried about school readiness. And so I might come back to you again, actually, Gihan, with this one, because I know that's something you see a lot in your practice. Her little child is approaching prep orientation this week, and she said, I feel like he's hardly been at kinder, and how am I going to know or help get him ready for school?
Yeah. Thanks, Anthea. And Janie, what an exciting time for your little person getting ready for school, a huge transition. And of course, we rely on exposure and spending time in those structured early childhood settings like kindergarten to build those skills. I think, parents have been doing a lot of that at home within the limits of the time they have available with working from home, etc. Look, I think the key things are to expect success. We know most kids will do really well. If your son isn't doing this by themselves, they're part of a cohort of kids who've all experienced similar things and are coming at school from this sort of shared perspective. And school systems are being so incredibly sensitive to the mental health and well-being of kids, and often for all of those year levels that are heading back after prolonged lockdown and for kids who are entering schools for the first time, there's a huge focus on keeping an eye on mental health and well-being and those really important transition times. The other concept of school readiness that I talk to parents a lot about is that school readiness isn't just the child and family's responsibility. The other half of the child being ready for school is the school being ready for the child. So I think if you are worried about your child having unusual reactions or great amounts of anxiety, do make early and frequent contact with the school, because they have wellbeing supports and school psychology supports that can really kick in even before your child has started school to make sure there's a really good plan in place for that first day through the school doors.
Thanks, Gihan. And Margie just popped her hand up. Did you have something to add, Margie?
Yeah, I would just like to add, as a mum of 4 kids as well, I've been talking a lot with my children's teachers, and the teachers are adapting as well. They're expecting that children like this are going to be coming to school for the first time, perhaps not as ready. So the teachers are prepared for that. They'll probably expect more of that sort of late kinder behaviour and then transition them into what they might expect for a new prep child. So as you said, Gihan, the schools are preparing, the teachers know, and there's a lot of kindness and understanding, I think, of that kids might not be where they might have been without the pandemic.
Thanks, Margie. And teachers and early learning educators have done an incredible job throughout this whole journey, as have parents and the whole community, but of continuing to adapt and respond to the changing needs of our kids. So we've just got a few minutes left today, and I think it would be really important to talk a bit now about parent mental health. And Georgie, I'm going to come to you with this question. And really, we've got lots of comments from parents as well about, how do I look after my kids when I'm not my best self, as an example from Jen or from Samantha. What are the signs that, my mental health is suffering? So can you give us some advice about how parents can support themselves and where they might go for help and how they might recognise that's something they need to do?
Yeah, absolutely. And I think the first kind of message that I want to, give to parents is everyone who is watching this right now is doing a great job. You're here because you care. You're here because, you want to be your best self, but let's also acknowledge that now is a really difficult time to be your best self, okay? And, we can just lower the expectations for a minute, with everything that we've been through this year. And I think Nero really spoke about this earlier. We are feeling depleted, okay? So, often when I work with parents, I'll talk about small things matter and back to basics. So same as you would be looking after your children with keeping those routines really regular, making sure that you're getting a lot of sleep, which is really difficult with small kids. I've got small people in my life as well. Eating healthily, going out and exercising. They're kind of the building blocks almost to your happy home that's going to function well. One of the ways that, we can really remember to do this is putting on our own oxygen mask first. I always think of that metaphor. I put on my own oxygen mask and look after myself, offer myself some kindness so that I am able to provide for the rest of the family. A really helpful kind of strategy to do in the moment is to use this lovely acronym, which is from acceptance and commitment therapy, uses a lot of mindfulness, called BOLD. So B stands for breathe deeply and slow down. So just never underestimate the power of your breath, to just allow yourself to slow down so you can make some really good decision making and actually be present in the moment with your children. O is observe your thoughts and your feelings. So just identify, wow, am I feeling overwhelmed right now? Am I feeling guilty right now? Am I feeling scared? Once we can actually label those thoughts or those feelings, we can just kind of, sit with them, let them go a little bit, let them pass. Live by your values. So what's important to you right now? You've got lots of different competing things, maybe connecting with your children is actually more important than loading the dishwasher. There's lots of different examples that you can kind of come to, but that's a really lovely, kind of guide to D, which is doing what matters. Okay, so, if you are feeling overwhelmed, if things are getting on top of you, just kind of come back to that BOLD and don't underestimate doing the small things. And I think in terms of the second part of that question, when should I go and get help? You're really tuning into changes in your own behaviour and your own thinking. So if you're noticing that your sleep is really disrupted, if you're waking up early, finding it difficult to get sleep, waking up in the night, that's can be a sign that our mind is going into overdrive. If we're noticing that we're really irritable with other members of our family, with our children, maybe more so than normal. Again, it's just a sign that we can tune into that, and we might need some extra help. And again, just those feelings of worry. If you're worried every day or most days, or you're noticing that your mood is really low, put your hand up for help and don't suffer in silence. This has been an unprecedented couple of years. You can go to your GP. You might even just reach out to your family or your friends. There's lots of things that you can do, but just reach out, get some help to put on that oxygen mask.
Thanks so much, Georgie. So much great advice in there and delivered beautifully by a psychologist in a way that, psychologists are so good at giving this information and making us feel held and calm. So if you are listening at home and thinking that you would like some extra help and support, we've got some helpline numbers that will come up on the screen for you there. And we will also put some information in the feed and the resources from this chat today. And that's about yourself, where you might need help, and also help for your children if you're concerned about their mental health and well-being. So I think that's all we have time for today, and I would like to thank our fabulous panel, Nero, Gihan, Margie, Georgie, for joining us and sharing so much of their wisdom and information today. I'd also like to thank the Victorian Government who have supported this webinar, and to ask a favour from all of you watching today, if you could hop online and fill in a really short 5-minute survey for us to tell us what you thought and help us to build some more of these events going forward to support parents and families as we keep on this journey that is continuing to evolve here with COVID. A big well done to all of you out there watching at home. As Georgie has said, just the fact that you're watching is a huge thing in itself. Parents, carers, educators, teachers have all done such a fantastic job on this very long journey that we're on. And there is some light at the end of the tunnel. We're out of lockdown. The holidays are ahead. So it's time to look forward to enjoying some of those opportunities to reconnect with the community and reconnect with our children and families as well. Thank you so much for watching today. I look forward to seeing you next time. Stay safe and go well.